Welcome doctors to my lecture. We are studying virology. Today, we will discuss an important topic related to hepatitis B, that is the serology. Please don't forget to subscribe my channel. It will help us to keep uploading more videos like these. Thank you.
Firstly, we will discuss the markers of hepatitis B infection. HBsAg stands for hepatitis B surface antigen, and it is a marker of infection. Anti-HBs stands for hepatitis B surface antibody, and it is a marker of immunity. Anti-HBc stands for hepatitis B core antibody, and it is a marker of exposure. IgM anti-HBc stands for hepatitis B core antibody IgM. It is the marker of the duration of infection. Understanding these terms is very important to grab these concepts. Now, we will discuss the interpretation of hepatitis B serology. Firstly, if hepatitis B surface antigen is positive, then it is a sign of infection. Now, we will see hepatitis B core antibody and its types. If hepatitis B core antibody is positive and type IgM is also positive, then this indicates acute infection. On the other hand, if hepatitis B core antibody is positive, but IgM is negative, then this indicates chronic infection. Note that IgM antibody indicates acute infection and remains in body for an initial 6 months. On the other hand, if hepatitis B surface antigen is negative, then it indicates that there is no infection. Now, we will see surface antibodies and core antibodies. If both surface and core antibodies are positive, then it indicates immunity due to previous infection, because in an infection, the body is exposed to surface and core antigens and forms antibodies against them. If the core antibody is negative and the surface antibody is positive, then it indicates that the body is immune due to vaccination, because vaccine contains surface antigens in the form of dead virus against which body forms antibodies. If both core and surface antibodies are negative, then there is no immunity, and the body is prone and susceptible to infection. Ladies and gentlemen, today I would like to present to you a graph showcasing the course of hepatitis B infection. This graph provides an overview of the various stages of hepatitis B infection, represented by curves related to the titers of hepatitis B surface antigen, hepatitis B core antibody, hepatitis B core antibody type IgM, hepatitis B surface antibody, and the window period, plotted against the time elapsed since infection on the x-axis and the titer levels on the y-axis. The red curve you see on the graph is related to hepatitis B surface antigen titer. This curve represents the period of acute hepatitis B infection, during which the hepatitis B surface antigen titer increases rapidly and then eventually declines. The peak of this curve indicates the highest level of hepatitis B surface antigen titer, which usually occurs during the first 4 to 6 weeks after infection. After this period, the hepatitis B surface antigen titer declines gradually over time until it becomes undetectable in most cases. The light blue curve on the graph represents hepatitis B core antibody titer. This curve shows that during the acute phase of hepatitis B infection, hepatitis B core antibody titer increases in response to the infection. The peak of this curve occurs shortly after the peak of the hepatitis B surface antigen curve, and then gradually declines over time. However, hepatitis B core antibody can persist for many years after infection, even in the absence of detectable hepatitis B surface antigen. The dark blue curve represents hepatitis B core antibody type IgM titer. This curve indicates the presence of hepatitis B core antibody type IgM, which is a marker of recent or acute infection. Hepatitis B core antibody type IgM is detectable shortly after the onset of symptoms, peaks during the acute phase of infection, and then declines over the following weeks. IgM anti-HBc usually becomes undetectable after 3 to 6 months. The green curve on the graph is related to hepatitis B surface antibody titer. This curve indicates the level of hepatitis B surface antibody, which is a marker of immunity to hepatitis B. Hepatitis B surface antibody can be acquired either through vaccination or natural infection. In the case of natural infection, hepatitis B surface antibody typically appears after the acute phase of infection, and the level of hepatitis B surface antibody gradually increases over time. The peak of this curve indicates the highest level of anti-HBs titer, which usually occurs several months after the acute infection. Anti-HBs can persist for many years, providing protection against future hepatitis B infections. Finally, the yellow box area on the graph represents the window period. This is the period between the disappearance of hepatitis B surface antigen and the appearance of hepatitis B surface antibody. During this period, no serological markers are detectable, making it difficult to diagnose hepatitis B infection. The length of the window period varies depending on the individual and the specific assay used for testing, but typically ranges from several weeks to several months. In conclusion, this graph provides a clear representation of the course of hepatitis B infection, highlighting the different stages and corresponding serological markers. By understanding the patterns of serological markers in relation to the time elapsed since infection, healthcare professionals can accurately diagnose and manage hepatitis B infections. Respected doctors, now it's time to test your knowledge. Please read the question below and all the options carefully. Take your time. As hepatitis B surface antigen is positive, so this is a sign of infection. Now we will see hepatitis B core antibody and its types. As hepatitis B core antibody type IgM is positive, so it is a sign of acute infection, so option A is the correct answer. Thank you. Always proceed like this step by step in attempting your questions. Take your time. Revise this lecture again and again and solve related MCQs. Now, please read this question and all the options carefully.
The catch point is window period. See the graph below. The dark blue curve, which shows hepatitis B core antibody, is present in the yellow box showing window period. So the correct option is D.